we're blessed to have a physician specialist, a nephrology senior resident in Kollywood Teaching Hospital. What I'm trying to say, he knows all about the kidneys. He goes by the name Dr. Louis Avoklia. Please join me, welcome him as he takes us through knowing your kidneys. Doc, over to you.
Yeah, good evening, every one of you. You are very much welcome. Thanks for making time to know your kidneys and knowing it very well. Thank you, Dr. Sediwa, for your kind introduction. So without much ado, because we don't have much time, I will just want to go straight into knowing your kidneys. And it's a very vital organ, but I think if you have put your ears on the ground, you realize that there are a lot of noise about kidney disease, and especially the treatment of kidney disease, specifically the dialysis. And also, I think 2 months ago, we had two patients of ours who had kidney transplants. They are very, it's a very expensive venture, which I pray that none of us get to that point. So that's why it's important for us to know the kidneys, what it does, the functions. Then today we'll also talk about the causes of kidney disease, the dysfunction. Then next week we are going to talk about prevention, treatment, and also complications that comes with treatment. So without much ado, I'll just go into it. So we're talking about a human kidney. Very important. So as you can see, the kidney, as you see, it's a pair of organ, or as I would say, it's a two bean-shaped organs, which is found in our flank. So you can see one kidney here, which is the right kidney, and the left kidney on the other side. Slightly, the right kidney is just a little below the right, is a bit below than the right or than the left, just because of the position or the anatomy of the liver. So the liver is just right above the right kidney. So just for us to know, right on top of the kidney, we have what is called the adrenal glands. So there are specific glands that do other things. So they are not part of the kidney, but it's just an organ on the kidney. So we should just take note of that. What is closely related to the kidney that is very important is the ureter. So there are a pair of them that connect the kidney to the bladder. So what the ureter does is that it takes, after the blood is filtered, it forms, the urine is formed by the kidney and is transported by the ureter, and then the bladder stores it. When we feel, or when there's a sensation of urine, it means that of you peeing, or you. So I'll go on, please. So it means that your bladder is filled, and then you have to take the excess fluid or the excess water, the urine that has been formed out by you urinating. So I brought this picture here just for us to understand, to appreciate the sizes of our kidneys. Some people will say it's just like the size of your fix, a fix that you've made in your hand. Or just for us to know, this is how the kidney sizes are. It depends on your body size. If you are a small person, a smaller person, your kidney sizes are smaller. If you're a bigger person, your kidney sizes are usually bigger. And that's the differences, the sizes actually matters, especially when we are diagnosing a patient of kidney disease. So I think it's something that we should know. Now, I brought this for us to also appreciate something very important. So looking at certain vital organs in our bodies, like the brain. You know, the brain is a vital organ. It makes, it's actually It's an important organ for our body. So you could see that the brain is protected by being in the skull. So is the heart. Heart is actually protected by the rib cage. So you can see the heart is around the side. It's the same way the kidneys needs to also be protected. It's also a vital organ. It's something that we the nephrologists, or those of us in the field of kidney medicine are also think that it's also a vital organ, and that also is also one way or the other protected. So we can see that it's just behind the rib cage. I just brought this part, this for us to understand that it is not just in the abdomen, it's just behind the abdomen. So medically, we call it retroperitoneal. So retroperitoneal means just behind the abdomen, meaning that it's a vital organ that needs to be protected by various organs, and also where it's positioned is also forms a protective means for it just to be protected. Just we don't want the kidney to be physically injured, or anything, any injury to the kidney could also cause a disease. So something that we need to understand how vital the kidneys are. So we now move straight to our kidneys. Why do we need the kidneys? Is simply getting to know the function of the kidneys. Then if you get to know about the function of the kidneys, I don't think you're going to play with your kidneys. So the first function I would say is the excretory function. I'm going to delve into it in the next slides or in the subsequent slides. So this is just to introduce the function. So the excretory function, meaning that there are a lot of metabolic waste that are being built up in our life processes that needs to be, to be taken out. So we'll explain that more. The other function is a regulatory function, keeping everything in balance. You know, our life needs to be balanced as people. I mean, wherever we find ourselves, we need to have a balanced life to have a better life for ourselves. It's so important for us to also know that the kidneys also regulate a lot of things. So I'll also go into that for us to understand. Then the last one is the hormonal function of the kidney, something that is very, very important. The kidney is not only known for its excretion function or regulation, also hormones. You know, we have different hormones hormones are different parts of the body that, glands are different parts of the body that produces hormone. So the kidney is not just an organ that produces urine or another, it also produces hormone. So it's also a very vital organ, or an important organ that we need to learn. So we will learn more as we go on. So I want to start with the excretory function of the kidney. Excretory function of the kidney. So now with the excretory function of the kidney, what happens, or what does our kidney excrete? I mean, something very important. As we as human, or we as living things, there are a lot of processes or life processes that goes on in our body. We have a lot of activities. We reproduce, we eat, we give birth, we have a lot of activities, we walk, we do a lot of things, we even think. So what is the machinery, or what is keeping us alive, or what is putting us into these activities that we are doing? It is what is called metabolism. There's a metabolism, there's a machinery, there's a biochemical reaction that is always going through your body. That machinery is always, what I would say is metabolism. I mean, so the metabolic activities in our body, one way or the other, will always produce waste. So for I will take our body as a unit, and for our unit to function, there's always going to be a waste that is being produced. Take it like an organization or a factory. Factories always produce waste just because they are functioning. That is it. Or you get to a functioning house, there is always waste that is being produced. No matter what, we will always produce waste. What the kidney does is that it takes this waste, it filters this waste, and brings it out. So the waste, the most important waste that I'm going to talk, the ones that are very important are the urea and the creatinine. These are waste that are being produced. So you can see that what a kidney does is to filter, so to just remove the waste. So one way or the other, I will use it as the sanitation unit, or the sanitary, or the zoom line, or something of that sort, for us to understand. So for one of the excretory function is to take away metabolic waste that are produced after certain life processes, which are in form of urea and creatinine. We go to the next function, which is drugs. So we take in medications. If you realize, when you take in painkillers, it works after some time. The effect of the painkiller is no more. Why? Because the kidneys are there to regulate the amount of drugs in your blood. So after its use, the drugs needs to be excreted or needs to be taken away. What happens? What is the cause, or what performs that is the kidneys. If you have a good functioning kidney, you are going to you are going to excrete your drugs. If your kidneys are not functioning and you take in some medications, you realize that the drugs might be in your body and might be toxic to you and might even cause death to you. So you should just take note of these. So after drugs that have been used, that have performed its function, after that, it needs to be taken out. What makes that happen is the kidney. We'll go to the last one with the toxins. We are exposed to a lot of toxins. We breathe in a lot of air that produces a lot of toxins. We drink water, it has some toxins, and all these things, we are exposed to everything. You understand? The kidneys have to take away, get rid of these toxins in order for it not to kill you or not to affect you in the long run. So you realize that we have gone through the first function, which is the excretory function of the kidney. Now, the second function is the regulatory function of the kidney, another very important thing that we need to know. So we'll start. So the regulatory function, I want to say that there's what we call water balance. You know, as I made mention of, I said earlier that when there's a unit that functions very well, right, you always make a waste. But a unit or a factory or a company or anything that also functions needs to be regulated. So there are rules and regulations that guide us. So the kidneys also is a regulator, or is something that balances you as a person. So the most important thing is the water balance. If you have a good functioning kidney, I bet you are going to, when you drink more water, you urinate more. If your kidneys are not functioning, when you drink more water, you can't urinate more and it will accumulate. So that's I'm going to talk about when we reach when the kidney fails. So I just want you to know that our body needs a specific amount of water at a particular time. When the body feels that, or the kidney feels that the volume of water in your body is too much, what it does is that it takes away. When the kidney feels that when you need water, it sends signals to your brain, because possibly the body has less water. It sends signals to your brain. And what it does is that it makes you feel thirsty. When you feel thirsty, you have to drink water. So it's a very good, important organ. So controlling the volume of water in your body, something very important for us to also take note. That is for water balance. Now, there are other things that also are in our body. We call it electrolytes. So if you are a science student, you get to know that we have electrolytes like sodium, potassium, calcium, magnesium, and so on and so forth. And we need sodium, we need potassium, all these things in our body for brain function, for muscle function, for you to use your muscles to perform activities. So we need these minerals, or sodium, potassium, calcium, magnesium. We need them in some quantities. It shouldn't be too low, it shouldn't be too much. So the kidneys also takes care of that. So if your kidneys are dysfunctional, you realize that if you do your labs, your potassium is high, your sodium might go high or low depending on dysfunction. So I think it's something that we should also take note for. So regulation of the amount of the amount of substance like sodium and potassium also in your body, apart from the water. And a very good functioning kidney, if you decide to drink a bottle if you decide to drink a gallon of potassium with a very good functioning kidney, you are going to excrete body. I mean, kidney will balance the level of what potassium. It's about the balance. The other thing, potassium or sodium. The other thing we need to know is that there is an acid-base balance. So these, for your body to function as for you to have a functioning body or a better life processes, there need to be an environment in which a lot of things or the metabolism goes on. So we need a right acid-base balance. So we need a balance in that part. So the kidneys also will actually regulate your body acids, your body bases, so that it will be in the right environment for your body to function and function very well. So that's, we've spoken about one, the excretory function. We've spoken about the regulatory function. Now we come to the third one, which we say the hormonal function. So for that, we can see that there is a hormone that is being produced by the kidney. For the hormone, that is that it stimulates your bone marrow to produce your red blood cells. So it's for us to have red blood cells, or you to have a lot of blood in your system, there need to be a functioning kidney. So we can see that it produces a hormone called erythropoietin, and also what stimulates the bone marrow. So within the bone marrow, there are cells that are stimulated. Then it produces your red blood cells, so blood cells. So with that, if you get to know about this function, you'll get to know that those with kidney dysfunction will suffer from anemia. So something very important for us to know. Then there is what we call activated vitamin D. So we realize that we eat a lot of, we get vitamin D from the sun, from the for the dairy products, from seafoods and that. And when without a kidney, the type of vitamins that the vitamins that are vitamin D that are found in these foods are usually an inactive form of vitamins D. You understand? So the vitamin D are usually inactive. So what the kidney does, that it activates it. When it activates it, it helps you create, to absorb calcium in your blood, and you are able to form your bones very well, and that is very important. So also a dysfunction of the kidney can affect your bones. So we have learned about the functions very well. So when you go online, you realize that you write 7 functions, but just that I've placed them I've just decided to put them under different topic for us to understand. So the excretory function, the regulatory function, and then the hormonal function. They are very, very important. I told you about excretory function, urea and creatinine, drugs that have performed their functions, and toxins that we accumulate over time. The kidneys will take care of that. Same for the balance, water balance. The more water you drink with a functioning kidney, you are going to pee it out. The more you urinate, it's the same thing. Electrolyte like sodium, potassium. The more, if you're functioning kidney, we maintain a balance of sodium and potassium in the blood. So it keeps balancing. That is it. So the more potassium you have in your blood, the kidney senses it and gets rid of some, just to maintain a specific balance. And also the right environment, acid-base balance. So the more acidity or the less acidity of your blood, the blood use or your body needs to maintain a specific acidic levels. The kidney would tend to get rid of more acid or less acid in order to maintain a better balance or an environment. Then the hormonal function, the hormone called erythropoietin, that stimulates the bone to produce red blood cells. That helps with our blood levels. So the less the dysfunctional kidneys will not produce, your blood levels reduces, and then you tend to, it will cause what is called anemia, because you are not able to produce blood. And then activation of vitamin D. We take in vitamin Ds that are in active forms. They are not active as it is. So we can, but without a functioning kidney, your kidneys cannot activate the vitamins to produce strong teeth and bones. So that is the summary of the functions of the kidney. So we go, what happened to a failing kidney? Now we have spoken about the function of the kidney. Whatever the opposites, right, will be a diseased kidney or a patient who have a kidney disease. That is basically that. So first, we spoke about the excretory function. So the excretory function will be impaired. So it's impaired. A failing kidney, you can't excrete. Why can't you excrete? Because your kidneys are not working. So what do? You accumulate metabolic waste. Your urea, your creatinine is accumulated. When we go and do your kidney function test, and you look at the levels of urea and creatinine, you realize that they are very much elevated, just because your kidneys are failing. So they accumulate. Where do they accumulate to? They tend to accumulate. They are very toxic to the body. They accumulate in the brain. You feel drowsy, there's confusion, you can get seizure, you can get coma, and even death. Very important. It can also accumulate around your heart. There's a recovery of your heart, and it accumulates around your heart. Recovery, we call it, it causes some severe chest pain that could even lead to death. It accumulates in your stomach. It can cause you to have nausea, vomiting, pains in your stomach, poor appetite. Imagine you having your kidney failing with all these parts. So you realize that almost all the parts of the body is affected when your kidneys fails. So this is when your excretory function is impaired. What if the regulatory function? I spoke about two regulatory functions. The water balance, I spoke about it, right? So meaning that if you drink more, what happens? You have to pee more. Your kidneys are not functioning. If you drink, what happens? Your urine will reduce. The amount of urine will reduce. You are not peeing a lot. This water that you drink tends to accumulate in various places. So one place that is usually accumulates is in your lungs. So imagine you getting drowned in water. So it's like water in your lungs, naturally. It's not you going to bath or you don't know how to swim, you go and bath and you are getting drowned. So when you get drowned in water, you have difficulty in breathing. So that is why they get shortness of breath. When they walk more, they do something more, you are breathing and breathing and breathing, and it's very difficult. And also accumulate in other areas of your body. So you realize that your body start getting bigger. It's in your body tissues, your legs, your body, your stomach, every part of your body is getting accumulated. So you realize that the patient is getting swollen. It is not just, it's not that the patient is getting fat. It's just that the patient is accumulating water. And that's also very important. You are also accumulate what? Electrolytes, because there's balance or regulatory function is impaired. So sodium could go high, potassium, especially potassium, is very deadly. The higher the potassium is going to affect your what? What usually happens is that it stops your heart from beating. Very, very important. So it can even cause sudden death. It can also cause very weak, severe weakness. So these are things that we need to understand, that if the regulatory function is impaired, you are not able to balance everything well, you accumulate these substances, water, and more of what? Electrolytes. So we should just make sure that we understand this very well. Another thing is that your hormonal function, the hormones are not working. As we said, you are not producing enough hormones, you are not producing erythropoietin. And when the erythropoietin is not being produced, your bone marrow will not form the red blood cells. You're not going to form, your blood level will reduce. Let me use that layman words. The blood level is going to reduce drastically, and it manifests as anemia. Anemia means low blood levels, simple, because so there are different types of anemia. But this one specifically is because your kidneys are failing. So what are the signs and symptoms of anemia? You get easily tired, you can't concentrate, you get dizzy, you feel that your heart is beating palpitation, easily get tired, you have weakness, and a whole lot of things. So kidney dysfunction is not only excretory, it's not only regulatory, but also the hormonal function too is also a very important aspect of it. Next week, when we talk about the prevention, the treatment, you will get to understand that some part or some aspect of kidney treatment will require you to take what is called erythropoietin, which is injected. So it is an artificial form of erythropoietin, which is injected into a patient with kidney failure on dialysis, that will need to stimulate their blood for producing red blood cells, so as not to be anemic. So that is for that. So we understand. How about bone health? As I said, we need kidneys to activate our vitamin D. So I spoke about dairy products where we obtain vitamins. I spoke about sunlight where we also obtain vitamins. Seafood, we obtain vitamin D. The kidneys needs the vitamin D to be active. So we get an activated vitamin D. So if your vitamin D is not, your kidneys are failing, your bones will become thin, you can get bone pain, or even risks of fractures. So sometimes you can get fractures. So you can see that you getting a kidney disease, it's something that I think it's a matter, or it's something that is serious, that we need to really be serious about. It's really an expensive venture, especially when the kidney disease is at the end stage, and it's something that we really don't, you will not even wish for your worst enemy. We'll go to the causes, very important causes. Something that I really want to talk about. I really want to spend my time here, because it's something that most of us needs to know in order to prevent kidney disease. So you have been diagnosed diabetes. It doesn't, you being diagnosed being diabetic doesn't mean that you're going to get kidney disease. It means that your diabetes is not well controlled. You don't visit your doctors regularly, you don't have your labs done regularly, and you don't take your medications as prescribed by the health caregiver. Very important. If you don't maintain a very good level of blood sugar over time, for a very long time, your kidneys will fail. And that has been the most common cause, hypertension, diabetes, the most common cause of kidney disease worldwide. most common cause of kidney disease worldwide. Same for hypertension. Hypertension, which is also poorly controlled. So hypertension, for those of us who want to know what hypertension is, just high blood pressure. So we call it BP. When it's also not controlled, you don't visit your doctors when you are diagnosed, you don't take in their medications, and you don't comply with lifestyle modifications that has been prescribed to you. Quite important. You should take note of that. Hypertension is also a serious killer. I must say that the first two, diabetes and hypertension, I will call it primary disease. One thing is that the early form of diabetes or early form of hypertension, when it's diagnosed early, it doesn't manifest. There's no manifestation. If somebody says, I'm diabetic, you will not know that the patient is diabetic, or the person himself will not even know. Same for hypertension. But the time you will get to know you have diabetes or hypertension, most of the time, is when you have had a complication of it, like stroke, heart attack, kidney disease. So the first two, which is quite important, it means that one part of preventing kidney disease is screening. You screen if you are usually above the age of 40, some even those of you who has family members who are diabetic or hypertensive, you start screening by the age of 35. That's my advice for diabetes, for hypertension. And if you get to know it's early diagnosis, early treatment, early prevention of kidney disease. In fact, it's going to be very good for you. So it's something that I really want us to know. Diabetes and hypertension, don't think that, I just want you to know that don't think that kidney disease is far away from you. No, it's closer to you than you think. There are other genetic causes of kidney disease. Something that possibly they have some few percentage of people in a community or people that I see at Kolebu Teaching Hospital with genetic causes. So there isn't any prevention, but usually you have 50% chance of having this condition if one of your parents have it. So we call it autosomal dominant polycystic kidney disease, so ADPK. So that's something I just want you to know. There are other genetic causes of kidney disease, but they are not as much as that of the diabetes, hypertension causes. I put herbal in question mark, just not to say that the people in the herbal space are not doing their work. No. They are, I think, it's just because some places or some some concoctions that are prepared by these herbalists will contain a lot of substances that can destroy your kidneys seriously. And we are getting a number of people with such diseases. And just because it's taking herbal medications for a very long time, it's destroyed. So I really want to be measured in my speaking here so that I will not be attacked by people in the herbal space. But I think we should be very careful when we are taking our herbal medications, and so as not to destroy your kidneys. I mean, something that also long-term use of certain painkillers, Jebridol, diclofenac, F-pack. We take it for a very long time. Have back pain. Anytime you have back pain, you have headaches, straight to the pharmacy. You are given these medications. They relieve you all right. But in the long term, when you take it for a very long time persistently, it's going to cause you to have your kidneys to fail. We have a lot of cases like that. So this group of drugs, we call them NSAIDs. I mean, Jebridol, diclofenac, F-pack, consistently, it could lead to kidney failure. So we should also take note of that. Then patients who have stones in the kidneys, you have recurrent stones, recurrent infections of your urinary tract. Now there is a problem that we are facing. There facing now. Currently, what we are facing now in Kolebu are some group of people who are in the younger ages. So we are having about 60% of our patients who are less than the age of 50, or let's say 45, who have kidney disease. Long ago, we had a group of, where most of the time, long ago, about 30 or 40 years ago, we had the group of people who get kidney disease were people who were in the very, very old age, like, I mean, the ages of 60, 70 years. Currently now, it's not like that anymore. And just what we are observing is that it's not the younger population that are getting kidney disease. Ages less than 30, less than 45, 40, 30, 20 years, 19 years. We are having a lot of them getting kidney disease. And it's an area we are researching into. What might be the cause? So we put them into a very big category of unknown causes. Of unknown causes. We are yet to know why. What is happening? Is there any genetic predisposition to that? We want to really know why these people, or why the younger population are getting kidney disease. I must also note that we are also getting a group of people who are also from these mining areas, exposed to this toxic compounds or substances that are used in refining the minerals that are being extracted. Something that's also very important. Also, the young guys who are abusing aphrodisiacs are also another group of people that we are also seeing at Kolebu Teaching Hospital. So that's something that we also need to know. Then aging. So as we age, your kidney, you see, naturally as we age, different parts of our body will not be as how it was before, or 20. Especially when if you are 40 years today, you are not as fit as someone who is 20 years today. All organs in our body deteriorate with time. So when you age, especially from the age of 60, your kidney deteriorates naturally, and that one counts with that. And one thing is obesity. Obesity itself is a condition that is not it's something that I really want to talk about, just because it's when you are obese, you are at risk of hypertension, you are diabetes, you are at risk of a lot of diseases of the heart, diseases of the brain, and diseases of the kidneys. And imagine you being obese, your kidneys only can function. So let's say your kidney, the size of your kidneys correlates to the size of your body. So if your body is bigger than the size of the kidneys, then your kidneys are going to overwork, going to do so much work, and the kidneys might get tired and might get disease. So that is something that I think we should all know, the causes of kidney disease that we currently have here. We'll go to when somebody gets kidney disease, what are the stages? So I will just want to mention these stages for us to know. So we have stage 1, stage 2, stage 3, stage 4, stage 5. Each and every stage and what they present. But I must say that from stage 1 to stage 4, right, people might have kidney disease, but it's not manifested. You don't have the clinical manifestation. You don't feel you don't have the symptoms. You don't